examination of the mouth, the pharynx, and the neck. But before that, we always have to remember these principles.
So, good morning, ma'am. I'm Nancy Alves. I'm a medical student. I'm gonna do your physical exam of the mouth and its associated parts. May I ask for your consent? First, may I know your name? Okay, so can you please remove your mask as I will examine your mouth? Okay, so first I'm going to inspect your lips. Can you please close your lips? Can you please slightly open it? I'm going to palpate your lips. Do you feel any tenderness? Do you feel any pain? Okay, so as I can see here, the mouth of the patient is symmetrical with each other. There are no presence of any ulcerations or any crust. The lips rather, is moist and pink in color, and there's no any associated abnormalities. So now I'm going to check the buccal cavity of the patient. So now can you please open your mouth wide open? Can you please stick out your tongue for me? I'm going to use tongue depressor for this examination to check for the buccal cavity. So can you please put your mouth wide open? Okay. Step now. So as for the buccal cavity of the patient, it is normal. There is no presence of any ulcerations or any white patches or any infections involved, and the septum duct is intact. So now I'm going to inspect the teeth of the patient. So now can you please smile for me? Can you please open your mouth slightly? Okay. Can you please make a line for me? Like that. Okay. Can you please open again? So as you can see, the patient's teeth is well aligned and there is no cavities or any associated conditions regarding the problems of the teeth. And now, lastly, I'm going to inspect for the gums of the patient. So, can you please open again your mouth for me? Can you please try to bite? Okay. So, as you can see, the gums are well aligned and there's no recessions or any bleeding and any other associated infections. So, the gums of the patient is normal and healthy. So, thank you for your cooperation, ma'am.
Hello everyone, myself is Krishnan. Today I perform examination of the mouth, which include the tongue, hard flap, soft flap, and tongue of the mouth. And so first of all, I am performing the tongue. So can you open the mouth? So in the mouth, we assess the color of the tongue, and if there are any lesions, like swelling or scarring, so tongue is to be normal. And now I will assess the mobility of the tongue, which is cranial, hypoglossal cranial node. Can you move your tongue left and right? So hypoglossal node is intact, which is normal. Now I will assess the soft palate and hard palate. Can you open your mouth? So the soft palate is visible. And for the hard palate, we assess the cranial node number 10, which is vagus node. If there is any deviation, that means cranial node number 10, which is vagus node, is abnormal, and cranial node number 10 is intact. Now I will assess the floor of the mouth. So can you lift your tongue? Floor of the mouth, we also assess the color of the floor, and if there is scars and if there is any scar or not. So floor of the mouth, which is also normal. Thank you.
Good morning, ma'am. I am Romar Piago, a medical student. So now I'm going to examine your pharynx, which includes the oropharynx, your soft palate, your uvula, and your posterior pharyngeal wall. So I'm going to use a light source, which is a light penknife, and a tongue depressor to examine your pharynx. Alright, so as I examine your pharynx, I observed that there are no exudates, ulceration, asymmetry of the uvula, and color changes such as erythema.
Good morning, I am Vanessa Galeza, the medical student. So today I'll be completing your tonsils to check for swellings, lumps, or tendons. So this will be slightly uncomfortable, but it should not be painful. Do you feel anything? So upon palpation, the size of the tonsil is normal. There is no swelling, there is no tender, and any signs of exudates. So now I'll be assessing your daughter to check the function of certain nerves in your throat. So I'll be using this wooden dotted record. So this may cause swelling. So upon examination, the gag reflex is bilaterally intact with symmetrical soft palate elevation with the normal functions of the cranial nerve line.
Hi, myself is Dr. Ashok. I am the third year medical student in Northwestern University. Today I will demonstrate the neck area and the lymph nodes and the thyroid examination. First of all, I will demonstrate the lymph node examination. The cervical area and preauricular area and auricular area lymph nodes, and after that the submandibular and submental area lymph nodes, and the deep hook lymph nodes also examined. First set the three finger and circular motion rotation in the preauricular area. And behind the preauricular and postauricular area. And after that, tonsillar area, lymph nodes, and submandibular and submental, and cervical area lymph node examination, and anterior cervical area lymph nodes examined, gently palpated, and deep cervical area lymph nodes is behind the submastoid muscle. And deep cervical, before the deep cervical examination, ask the patient to turn the head. Please turn the head. Supraclavicular lymph nodes, in supraclavicular, above the clavicular area lymph nodes is palpated, and infra and below the clavicular lymph nodes. And occiput lymph nodes is behind the neck. Identified any pathologies in protruded pea size area lymph node, pea size of lymph nodes is protruded. No any lymph nodes abnormalities is noted. Now I will demonstrate the thyroid examination. First of all, inspection. First stage of inspection is clearly visible in the thyroid area and neck area. Now I have palpated the thyroid in first main of the cartilage of the landing mark is helping area, and palpate in anterior palpation. Observe any tenderness or masses. Okay. Next, mobility test. Before the mobility test, ask the patient a glass of water. Take a glass of water. After that, swallowing, clearly observe thyroid protrudes increase in suspected graves. Now I am auscultate the thyroid. Thank you.
So now we will begin with our neck examination. Myself, Dr. Saeed Khalifa. So before beginning, I will need to test your neck activity. So first I will start with the inspection of the neck. I will check for any noticeable asymmetry or any scar or any lesion or neck or any deviation of trachea visible. So no visible scars or lesions. Now I will palpate and check for any mass or abnormal. no tenderness or swelling or mass is noted. So later for the range of muscles of neck, for that I will ask the patient to please move tilt your head laterally. Let me know if you feel any pain. Okay. So no limitations at the lateral group of muscles are normal. Can you flex your neck? Here, let me know if you feel any pain. Extend. Okay. So and can you try to swallow? So here I am checking for any uniformity problem in swelling, which could be the indication of a problem in muscles of superior hyoid, or while depressing, it could be among the inferior hyoid muscles. It's a group of muscles for superior. It includes mylohyoid, digastric, superior, anterior and inferior, anterior and posterior. For also it includes stylohyoid and genohyoid. For inferior muscle of hyoid, it's also a group of 4 muscles. And then I will check for trachea if there is any deviation. For that I will use my index finger and ring finger. I will place both this finger on the head of the triangle like this, and then I will put my middle finger on the trachea. And if it's symmetrical, it's normal. If there is any deviation, it will be indicated with my middle finger with any deviation. Usually the deviation is ipsilateral in lungs collapsion, if there is any lung collapse or abscess. And it's on another side of deviation when there is a pleural effusion or any tumor of the pleural. So also if there is, I will check for range of motion of trabeculomastoid and other muscles which help in flexion and extension. For that I will ask the patient to put to the 45 degree and extend his neck. Did you feel any pain? Can you look on the side? Okay, so here no pain is noticed. Generally it is known as a spooling test. In that we usually do the similar thing, but we ask the patient to extend her neck and then look at this side. And I will do last slide pressure on this side. Another side. Extend. This is transporting maneuver which is used to test the reticulation of the cervix. If there is positive, then patient will feel any irritating pain or pain to the arms.
And that would be all for the examination of the ears, the nose, and the paranasal sinuses, and lastly, for the mouth, the neck, and the pharynx. I hope you learned something.